Good morning, all. Welcome to the second installment of IPMG's webinar, The Big Picture and Beyond, What the COVID Crisis Has Taught Us. We appreciate you folks who were on line last week and your patience dealing with our technical difficulties. Today, we're going to do a brief overview of what we talked about last Tuesday as a lead-in to Dr. Kim Gasson, IPMG's Clinical Field Service Director, and Brian Devlin's presentation. He's a Senior Vice President for our Risk Management Services. And they will be giving us a little bit more insight as to the tools and resources necessary and why they're necessary to address the issues that we talked about last week, and we will recap here shortly for you. Katie, please advance the screen. As you see there, the webinar schedule is set up for you. We're going to take a bit of a hiatus here with the holiday coming up and allow everybody to get back into the workflow and come back on the 14th of July, where we'll be talking about absence management along with some of the legal factors that have come into play, particularly with FMLA in light of the COVID crisis. And then on July 21st, we're going to talk a bit about workers' compensation, employee benefits, and the inefficiencies of the siloed approach and some resources and ideas about how to address that to create a more efficient, impactful approach to the ongoing and overall health condition of your employee. So the recap from the June 23rd, we had cited quite a bit of information that was provided us by a CDC study that had just come out that was from mid-January to the latter part of May. Much of what was provided us in that particular study identified that overall physical health is a leading cause among working age population for COVID-19 severity of contracted. Primary working age population we're identifying as ages from 30 to 59. Mental health, particularly depression and anxiety, has become more prominent and pronounced given the fear of the unknown and the constant cycle of news as it pertains to COVID and obviously the other issues we're dealing with as a country. Please advance, Katie. So the CDC study that came out, and you can see the dates identified there above, they tracked 1.3 million total cases. 184 cases of those 1.3 required hospitalization, and there were 103,000 deaths, just almost 104,000 deaths. Of those that were hospitalized, the prevalent underlying health conditions were cardiovascular disease, 32%, diabetes, 30%, and chronic lung disease of 18%. Of those hospitalized, and who had two or more of the conditions we identified above, they were 6 times more prevalent to be hospitalized if they had 2 or more conditions. Death was 12 times more prevalent among this group if they had 2 or more of what we are terming comorbidities identified in the above. Pretty stark numbers and startling to see the impact that an individual's overall health has on the severity if COVID were to be contracted. So if you look at the working age population of that 1.3 million, it was approximately 50% of the total of 1.3 or 670,000 folks. Of those folks, 21% had cardiovascular disease, diabetes was 24%, and chronic lung disease was 15%. The prior numbers were the overall numbers as they pertain to those who contracted diabetes or contracted COVID, excuse me. These numbers are pertaining strictly to that prime working age. Worth Magazine also did an analysis of the CDC data based on earlier data that came out. And they identified that 90% of non-age-related COVID-19 hospitalizations were due to the above categories. So those folks who didn't fall into that vulnerable age bracket of what they're saying to be 60 and above, 90% of those folks were due to those categories that we identified. And an article that was written in 2018 by Bruce Japson, who is a leading health contributor for Healthcare Magazine. And this information came out obviously prior to COVID and even being on our radar. In a study that was conducted by the Integrative Benefits Institute, which is a well-known organization that identifies and does analysis of workers' compensation, employee benefits, and the expenses associated with employers in the United States. And working with 66,000 U.S. employers, they identified that $880 billion were spent on healthcare benefits for their employees and families on an annual basis. 60% of those dollars spent were due to chronic or overall health of the employees, typically chronic, which we're talking about in a comorbidity fashion for diabetes, for hypertension, for chronic lung issues, for obesity. All those factors, those chronic health factors, accounted for 60% of that $880 billion health spend. Additionally, the study identified $530 billion of costs that are associated to the overall health of the employees, but were not directly related to benefits, and those costs are broke down for you here. So when you look at these numbers and you identify the health benefit costs, 60% being related to the chronic disease issue, and then the $580 billion spent for other costs that are outside of the strict health benefit label, you see where we have $178 billion for wage and benefits, including FMLA, $198 billion for impaired performance attributed to chronic health, $48 billion medical and pharmacy costs to workers' compensation, $25 billion for workers' compensation costs due to illness and reduced performance, and $82 billion opportunity costs of absence, including missed revenues and costs of hiring, substitutes, and overtime. The dollars that are being expended by employers, of which many of you folks who are attending the webinar today, are astronomical when it comes to the chronic issues. As we identified the percentages in the previous slides, 20% of the folks that were hospitalized within the prime working age, and more than 20%, depending upon the category, fell within what we would consider to be chronic comorbidity, ongoing health issues that lend themselves, that are reflected in these numbers in the 2018 study. Ironic that those numbers were produced and the study was done well before COVID was even on the national or international stage. Katie, can you please advance the screen? So the correlation, the CDC estimates that 42% of Americans are obese. These are numbers that come at us every day. 20 to 22% of Americans have 3 to 5 comorbidities. Those are the ones that we've just identified in previous slides. 60% of the healthcare spend is related to chronic disease, or $528 billion. 100% of poor worker health costs U.S. employees $530 billion annually. You put those numbers together, and we're looking at a cost to U.S. employers for chronically ill employees, meaning those who have 3 to 5 comorbidities, of over $1 trillion. When you look at the COVID numbers and you layer those on top of the overall numbers for the U.S. working population, the numbers are uncannily and eerily similar. If you would advance, Katie, please. So when you look at those numbers, what they're really saying to us, whether it be COVID, whether it be overall health, or it be a combined issue dealing with both, 20% of the employee workforce is driving 70 to 80% of all expense for employers. That's a huge number, considering the number of employees that are driving that expense. So as an employer, what do? How do we address the issue? How do we find resources and tools and the ability to be able to address that 20%? Because therein lies the ability to be able to reduce the expense for you folks as employers, for IPMG as an employer, but also enables us to look at improved productivity, happier, healthier workforce, and all those positive factors that go along with that. And one of the key to successes, which must occur, is engagement of the employee on every level. It's important to have the data to point you down the right path, to give you the understanding of where the issues are and what needs to be addressed. But without engagement at every level, addressing those issues that are driving the cost for you folks and employers across the nation, the numbers themselves will not succeed in reducing the cost to employers. Resources must be employed to address the emerging risks as well. We know that the numbers are a little gray in that we have employees that may not fall within that 3 to 5 comorbidity sector, but are emerging there and will soon be there if they're not given tools and resources, and the partners that are working on behalf of employers are not addressing that emerging risk. And we also need to be able to continue to encourage healthy employees to stay healthy so that they don't go into the emerging category and then ultimately into that category that is what we call essentially the burning building category. So today, Dr. Kim and Brian Devlin are going to talk about the impact of your employees' overall physical and mental health during the current crisis and beyond. There's going to be some insightful information brought to you folks today and some understanding of really what does this mean and how can we address it together to bring meaningful change. So I thank you folks again, and I turn it over to Brian and Dr. Kim. Thank you.
Thanks, Greg. My background before I started at IPMG, I started my career in physical therapy. So I had some observations of how a person's health would either influence or complicate the injury recovery that they were coming to see me for. So that was the first kind of insight that I had, that a person's health had a big impact on how they recovered and the benefits that they use after an injury. And subsequently, when I got into insurance and into risk management and sitting in claim reviews and looking at some of the larger claims that we would have to touch, there was oftentimes health that was complicating that claim. And in that case, work comp kind of took a side, or they would not really do a primary responsibility for that health that was complicating the injury recovery. So it was just kind of left on the sidelines. Well, we had long interest in that, and being a clinician and working with Dr. Kim, we thought there may be ways that we could design services that would go after some of these complicating health factors, comorbidities like Greg mentioned, and to see if we could use data to point us in directions where we think we would have a big impact or the ability to impact the benefit period, the health of the employee, and maybe the chance that they wouldn't have a subsequent re-injury to a body part in the work comp space. So we're very interested in designing insurance management systems for our clients and trying to understand their data more, because that is where we spend our time, and that's our commitment to the client, is trying to understand where they have unusual either benefit utilization or even could be litigation for liability. We have intense interest where there is data that's running hot or should draw our attention, and that kind of gives us inspiration to design services that can have a big return like what we're going to talk about today. So next slide, Katie. So Greg mentioned earlier the link to COVID-19 and comorbidities. And comorbidities is just a simultaneous presence of two chronic conditions or diseases in a patient, like diabetes, obesity, hypertension, sleep apnea, cardiovascular disease, COPD, osteoarthritis. All those are comorbidities, and they complicate either injury recovery, illness prevention, or even disease recovery. So those things are complicating factors, and we look at some of the behavioral mechanisms that an employee has that contribute to those comorbidities. And that's where we've had success through engagement, like Greg mentioned. These are not wellness plans or wellness services. That they have some similarities, but it's not a blanket approach. It's really targeted to the people that are usually the most unhealthy. And we try to do services that are really in two primary spaces: in the pre-incident space and in the post-injury space, which is the recovery services. So next slide, please. So the complexity of the problem we talk about, long before there was COVID-19, we had that intense interest in comorbidity management programs, health management services that could improve a person's health and thereby hopefully shorten the benefit period, and again, lower the chances that they're going to have a repeat work comp injury. If you show us an unhealthy person, we're going to show you someone that has problems with injury recovery, disease management, or even illness prevention. Next slide. So we arrived at these two primary services, what we're going to talk about today, in the pre-incident space, and that's before any type of injury or illness or disease is identified. We try to work with employees and identify high risk markers that we think are predictors of if a person is going to be sick, or think we can make some material improvements in their health by behavior modifications and things like nutrition and fitness. It's very fundamental health that we're going after. This is long before these things turn into a problem and it complicates the benefit period, or it causes injury or illness problems and the recovery of that. So the injury recovery and health management programs we're talking about is Badge of Health and enhanced case management. Again, they're not wellness plans, they're targeted services that really impact health risks that complicate the injury and disease and illness recovery. Administering these health management services, I says, it improves the odds, but it really improves probabilities. If we focus on these services, then the employee usually is going to have better health, and they're going to have less chance of having a complicating injury from work comp, or they're going to have the ability to recover from that better. And COVID-19 has some of the same risk factors with comorbidities that complicate the disease. It doesn't mean that you aren't going to have a severe disease if you don't have any comorbidities, but certainly there are comorbidities that complicate the disease recovery and the severity of the disease. So you can see that comorbidities not only influence the current conditions that we're in with COVID-19, but they also influence, health benefit utilization in the work comp and in the group space. So we have intense interest in that because that's where our members have most of their insurance action, and that's where we've had most success in engagement. We embrace technology for the analytics that it provides us and pointing us to areas that we should have interest and designing services in. We also recognize the limitations that it has. Our engagement comes from the human to human part, where Dr. Kim works with a person and notifies them of where they have risk factors. And I think that she can get them engaged with these services that improve their health, improve their productivity, lowers the absenteeism that they have, and thereby you have a more productive employee at work. So all the things that go along with this, the math involved, if you have an unhealthy employee and that unhealthy employee has a work comp injury, it's going to extend the benefit period. It's going to complicate the period and the benefits that they use. If we're able to improve health before the incident even happens, when they do have an injury, they're going to have less complications and a shorter benefit period. So that person's going to be more productive. They're going to have less lost time. There's a lot in the budget that supports why we should be pursuing this and why Dr. Kim has been so successful in getting engagement from the people that have the most risk for really actually using the most benefits. And once we're able to improve a person's health, I think there's a lot that goes along with happiness, like Greg mentioned, with well-being, with their job satisfaction. And we just don't want to use the normal health process or the health, what they go through the healthcare system. That's usually disengaging, and there's a disconnect with that. And these services aren't a primary interest to traditional insurances because they usually don't have necessarily a stakeholder position in it. We recognize the value in these services and what they do to improve health and then injury recovery. So I'm going to turn it over to Dr. Kim now so she can talk about Badge of Health and enhanced case management and what those services do to improve employee health and safety. Dr. Kim.
Hi, everyone. Thanks for joining in today. And the guys are trimming my bushes outside my windows. Can you hear that? Can you hear that, Brian?
It's not bad, Kim, so you're pretty good.
Okay. I'm like, oh, that was perfect timing. So I, as Brian, I'm a healthcare provider. I've worked in industry for the past 25 years of my career, working with employers at helping employees reduce injuries as well as improve their health. I've been fortunate enough to link up with IPMG in 2012 and work with an organization who had the exact same philosophy that I did on getting people well. You wouldn't normally think that an insurance company or a TPA would be interested in that type of thing, but that has really been the main focus of my career here at IPMG for the last 8 years. So I'm just going to dive right in. So some key contributors in the progression of chronic conditions such as comorbidities, such as diabetes, hypertension, or blood pressure and cardiovascular disease are linked to preventable illnesses. I'm referring back to some stats that Greg put up earlier on the cost of in billions per for U.S. employers, and it's 880 billion. And then when you look at that cost and think that 60% could be preventable, that's astronomical. And when we look at some of these risk factors, when I speak to people, I always say this. I always like to talk to employers, and I always like to talk to the audience. But more than anything, if I can make a change in one family once a day, I've done my job. And my hope is that you'll take some of this information with you today and take it home to your families, take it home to your friends, because I think that the education behind what is going on in our country and its contributing factors towards these comorbidities is really essential. So we look at lack of physical activity, poor nutrition, chronic stress, smoking, and the overuse of alcohol as some of the key contributing factors. And then when you look at our healthcare system, practitioners are in a very reactive state. So we have more healthcare providers now just trying to keep up with critical illnesses. One of the problems with COVID is that it spreads so astronomically fast. There's a formula called the R naught. It's R0 is how it's written out. And when you look at the flu spreads one person to one person to one person to one person. But when you look at COVID, one person spreads to 3 people, and then those 3 people spread to 9 people, and those 9 people spread to 27, and so on. So the infectability of COVID-19 is astronomical, and that's why it spreads so far across our country. And most people have mild symptoms or are asymptomatic, but because it spreads so fast, our healthcare system cannot keep up with the people that are needing to be in intensive care. So this is the need for quarantine. This is the need for keeping people in isolation to slow this thing down. We've had many people die of different and more chronic conditions. However, our healthcare system can't keep up with it. And once people are in the healthcare system with these chronic conditions, they get lost. And we're managing them with medicine versus preventative care. So we, as employers, as TPAs, we're left with no choice but to provide preventative programs for our employees. We have to step up and step in to do our part. Go ahead, Katie. So according to Dr. Robert Eckel, he is the president of Science and Medicine at the American Diabetes Association. Parents don't have a greater risk at contracting COVID-19. However, they face a higher chance of experiencing serious complications of COVID-19. So if COVID-19 is a respiratory problem or a lung issue, then why is diabetes a problem? 463 million people globally have diabetes, either type 1 or type 2. Type 1 diabetes is where your body does not produce insulin, so you have excessively high blood sugar levels, and they have to inject the insulin in their body to keep their blood sugar levels low. In type 2 diabetes, our bodies just don't know how to use the insulin that our pancreas makes. And in people with high blood sugar levels, this makes people more susceptible to many illnesses such as heart disease, stroke, poor wound healing. We hear of diabetic patients having amputations, losing their vision, and all sorts of things. So naturally, chronically elevated blood sugar levels suppress the immune system. They decrease the antibodies, or the little fighter guys in our body that attack and fight off infection, such as the novel coronavirus. So risks of getting sick from COVID-19 is likely to be lower when your diabetes is well managed. So the key for a diabetic patient is to have their blood glucose levels in a very healthy range and controlled. I cannot think of a time that there's ever been a more important time for people to keep their blood sugar levels in a narrow band of normal. So if there's anything you take away from this today, diabetic or not diabetic, cut the sugar out. It feeds viruses. Okay, go ahead. So one of the things that we focus on is teaching people to be different versus do different. A key component to a successful outcome is changing people's mindset from willpower to why power. So I believe everybody wants to be healthy and everybody wants to be free of disease and be energetic. And we may start a weight loss program or a fitness program after we see a good show or something on TV, or we have a cruise or something to go to. But over time, if our why is not greater than our will, then that Krispy Kreme donuts and pizza and beer on the weekend and things like that wins every time. So one of the things we focus on is creating why power. Why do you want to be, why do you want to engage in some sort of a fitness program or exercise program or lose weight or keep your blood sugar levels under control? And we talk about those things with our patients. Food and sugar addiction is real. It's just as real as cocaine addiction. They've done many studies on this. Some people lose 30 pounds to turn around and gain 40 as long as they don't have that sugar in front of them, or as long as they do not eat the sugar or carbohydrates, they do fine. But the second they have that taste, all those receptors and that addiction comes barreling back full bore, and they end up gaining their weight back, or they end up throwing their blood sugar levels off. Living a sedentary lifestyle is a habit, and it's extremely to overcome if we do not have enough why power to overcome it. We can't just sit on the couch and watch TV all night and not do anything. Our why power, why do I need to get up? Why do I need to get moving? Even if it's just a little at a time. So if we engage a patient at all levels into changing who they are versus what they do, this is where we gain the greatest outcome. We help them focus on their why power. Okay. So a book written by Dr. Kelly Starrett, she's a physical therapist and an author of a New York Times and Wall Street Journal best-selling book, Desk Bound, Stand Up to a Sitting World. She shared a few studies. An Australian study showed that every hour of television watched after the age of 25 reduces a viewer's life expectancy by 21.8 minutes. Smoking a single cigarette reduces life expectancy by 11 minutes. For every hour we sit, we lose 2 hours of life. And a typical seated office worker has more neck pain, back pain, hip pain, muscle aches than the typical industrial worker. So it's so important for us to get up and get moving, especially during this time. Exercise is an absolute must during this time. And we've got a lot of reasons now as to why we wouldn't exercise, and I'm going to talk about those more towards the end here. Okay. So your body changes every day. Cells die and new cells grow, new DNA grows. DNA is how your body replicates and grows, your hair, your skin, your lungs, your GI system, your stomach. And every 21 days, a red blood cell dies and a new one is born. And our bodies will regenerate, and it directly correlates with how we treat it. It doesn't matter how old we are. However, the amount of time it takes to replicate, or the level of replication, is obviously greater in an infant baby that is growing very, very rapidly, or in a teenager, and that regenerative process slows down as we get older. However, we do regenerate. So if I'm 80 years old and I cut my hair grows back. If I cut my nails grow back. If I have my skin, a wound, it'll heal. However, it replicates at a slower level as we get older, and our bodies will regenerate directly related to how we treat our bodies. So if I decide that I want to smoke, or if I decide that I want to have sun exposure, I'll have double strand breaks in my DNA, and my DNA will regenerate as what? As cancer. And if I decide that I do not want to eat my B vitamins, and I want to eat a high carbohydrate diet that continually depletes my body of B vitamins is required for energy, making of ATP in our mitochondria and our cells. So if I eat a high carbohydrate diet and my mitochondria is getting all eaten up, guess what? I'm going to have chronic fatigue. I'm going to have chronic tiredness from eating high carbohydrates and not regenerating my mitochondria or my ATP in my body. However, if we eat healthy and we eat antioxidants such as vitamins A, C, E, and fish oil and all these good foods and vegetables and fruits and all this stuff that's naturally occurring in our bodies, guess what? That those DNA breaks and those free radicals get bound to those antioxidants, and we have a decreased chance for our arteries, our vessels, our heart to kind of get beat up over the years. So it's very important for people to understand what they're doing to their bodies when they make the choices that they do. When they do what they eat, and they exercise and things like that. So the Center for Lifestyle Medicine at the Cleveland Clinic identified that people who participate in comprehensive lifestyle modification programs experience rapidly, significantly meaningful, sustainable improvements in biometric, laboratory, and psychosocial outcomes. So we can change people. We can help people. Unfortunately, even with our programs, we're probably at a 20% engagement, even when we choose to pay for it. So, it's what we call it?
Farming in the desert, right, Kim?
Right, farming in the desert. It's tough to get people engaged, and I'm going to talk a little bit about why we think that is too. So next slide.
Kim, it's also worth noting that we're targeting probably the most at risk. So getting those folks to change behaviors, change habits can be really challenging, but it's still worth the pursuit because of the return that it's had on improving employee health and the changes in their lives. And we've taken people that thought they were never going to be able to be a police officer anymore, and were going to be a perm total, and they're working and in good health. So those success stories still drive us in making sure that we make these services available, that we try for the engagement. And if someone refuses, we can't make them. But the people that are ready to make that change are at that tipping point. Kim's been really successful in getting those people past the finish line.
Right, and then even at those lower percentages, we're still seeing just astronomical benefits. So, okay, so a British study suggests that sitting less than 12 hours per week decreases a diabetes risk by 75%. So if you can time yourself to not sit less than 12 hours per week, you decrease your diabetes risk. Women who exercise not only live longer, but are also more likely to remain cancer-free after their treatment, and suggest that even a modest amount of exercise can be beneficial. Aside from that, exercise increases mood, decreases stress, and improves the brain's feel-good hormones. There's a hormone in your brain called serotonin, and there's also hormones released from your adrenal glands called cortisol. Cortisol is catabolic. It breaks down your tissues. It's the fight or flight stress hormone. It makes your heart race. It makes your blood pressure go up. It makes you break down muscle to create sugar. And over time, chronic stress leads to chronic heart problems, blood pressure problems, diabetes, for the reasons that I just explained right there. Exercise, they've done studies on exercise against SSRIs, which are antidepressants, the typical antidepressants, and they found that when people exercised, they had a longer sustainable benefit from exercise than they did from taking their antidepressant or anti-anxiety medication. So, kind of giving people this sort of information is super beneficial to them. And we all know it's always hard for us to get up and get exercise, and it's sometimes one of the toughest things for people if they're not used to exercising. Getting up and getting going is very difficult. However, once they do, they always feel better. They say, "Oh, I'm glad I did that. I feel so much better." And it's physiological. It's not in the mind that you actually feel better. You actually do feel better. Your hormones change. It changes everything. You sit in your desk for a long period of time, You have a 45-year-old, 50-year-old female, estrogen levels are high. We aren't exercising. That estrogen and prolactin and all these other hormones in our body just kind of hang around. It causes us to gain weight. It has us, it helps us to, not helps us, it hurts us actually, develops hormone related issues. Men who sit chronically, their testosterone over time gets converted into estrogen, and they lose muscle mass, they lose energy, they lose sexual dysfunction, to mood swings, to different things that are related to perimenopausal women. And you know, these are real issues, and exercise can really help some of those things. And we talk about those one-on-one with our patients.
Kim, it's worth noting that the folks that have given us the testimonials, almost every one of them to a T has commented on the improvement in their mental health.
Absolutely. Yes. Actually, mental clarity. I think clearer is pretty much what they say. We get rid of that mind fog.
Wake up in the morning, they want to participate in the day, where before they were holed up behind the drapes and not wanting to participate with society.
Yeah, and on the contrary, those people who exercise regularly can't wait to get up and go. So after that 21 days, after you do something for 21 days, they say it creates a habit. There's different numbers on that, 21 days, 30 days, or whatever, but you have to do it consistently for 21 to 30 days. No matter what, you get up, you do it, even if you don't want to. You don't make an excuse. You get up, you exercise. Then after that 30 days, when you miss a day of exercise, it's almost like people say, oh man, I missed my exercise. It's almost like not brushing my teeth. I just don't feel the same. Or wearing dirty clothes. You just don't feel good. So you know, healthy habits are also something that becomes addicting as well. Okay, next slide. So now is the time. We must stay as healthy as possible. Taking care of ourselves now is more important than it's ever been. Gyms have been closed, restaurants have been closed, people can't interact with their coworkers, they're not hanging out with friends. Chronic stress and feeling down of the unknown is creating lots and lots of mental stress and emotional stress on people. And the world has changed and may have changed in many aspects forever. So we need to start focusing on things. And we actually had to have a team meeting here at IPMG, because the way we rolled out our programs was that we would hire personal trainers and get gym memberships for folks, and you know, hire dietitians and different services that, or vendors that we would outsource based upon what the employees' goals were. Well, then when I was reaching out to people, the conversation I initially had the first week of shutdown was, hey, you know, we're offering you the service. Is it something you want to do? Yeah, but all the gyms are closed, so I can't really do anything. So we'll just wait for everything to open back up. Well, here we are, you know, 4 months later, still having issues, people not wanting to go out, people in a high risk that shouldn't be out. I mean, this could change our lives forever. Kids not going to school. We have to, and now that I've been in this, you know, for 8 years, running this program as well as working with patients for the last 4 months, it makes me realize something in the world has changed, and may have, and it's, you know, all based upon perspective, may have changed some degree for the better in how people live their lives. People are going to have to exercise at home. So we've hired trainers to work with people remotely via Zoom or FaceTime or something remote, in which they work with trainers at home. People are learning to cook at home. I know I have friends that don't know how to prepare a meal for themselves. So they were eating all the time, or eating pre-made meals and just cooking that way. Whereas people now are at home, because they can't interact with coworkers or go out and hang out. Some of these folks are reigniting their interpersonal relationships, their marriages, relationships with their kids. People are having to read to their kids. People are having to help their kids in school. And, you know, like I mentioned a few minutes ago, grateful living and perspective on things creates a whole nother world of health, and being grateful, telling people thank you, being thankful that we have a job, being thankful that we are able to continue to go to work every day. You know, some people complain, I got to go to work today. You know what? I'm grateful I have a job. I'm grateful I can work for a company that believes the way I believe in taking care of people and will stand behind it and fund it. So it's the attitude of gratitude, I call it. So people are now feeling chronic stress and feeling of the unknown. One of the things that we offer, if one of our employers has an EAP, an employee assistance program and counseling, we'll drive them towards that resource. And I let them know it's normal. It's okay. We all go through this stuff. Get the help you need. You'll be amazed at some of the resources or some of the things that they can help you with in coping with the stress. You know, we've seen, you know, Zoom meetings where groups get on there. My mom is at home with my father who has Alzheimer's. She's been in Taekwondo her whole life and hasn't obviously been in it for probably 20 years or so, but she reconnected with a group of all of her old Taekwondo referees and coaches and things like this, and it's been good for her. So, you know, creating time for doing those types of things is very, very important. We are resilient creatures, and we are meant to change, and we're meant to adapt, and we need to. Next slide. So we developed this program that Brian mentioned, Enhanced Case Management Services. It's a division of our case management program. And we coined this program after, actually I didn't attend this program, but Brian attended a program down in Miami and had met with Kevin Confetti and Dr. T. Warner Hudson and had heard them present. And he came back all fired up that we absolutely have to provide these services for our workers' compensation injury or claimants at IPMG. And that's how we started this program. Basically, it is a voluntary program. Basically, we identify claimants with comorbidities. So how do we identify the claimants? Either it comes in on a medical record or it comes in on an ICD-10 code on the claim, and our system triggers whether or not they have a comorbidity. Hypertension, diabetes, obesity, all the comorbidities that they had mentioned earlier.
Hey, Kim.
And, yes.
It's also worth mentioning the other triggers that we use is for anything past 2 weeks of lost time. If they have more than 30 days worth of opioid use, they have more than one work comp claim. Those are triggers that are automatically filtered through that we will look to see if there's opportunities for us to administer the services and improve some of the health that might improve the injury recovery or that benefit period.
Yep. Yes, so some of the interventions that we employ is exercise training. So I'm just gonna explain like how I go through it. So I'll basically contact an employee, let them know they're eligible for the program, kind of weigh out whether or not they're really interested or committed. If they're not 100% committed, I just don't work with them because I do not want to waste time or revenue on someone who's not really interested in getting their health better. So, and that's done through kind of motivational interviewing. So based upon their health goals, so let's say it's a patient who wants to lose weight, which is probably 90% of the cases that I work with. Some are stress, some are smoking, some are just want to improve physical activity and such. But depending on what they want to do and depending on, let's say they want to lose 20 pounds. If they want to lose 20 pounds, I'll connect them with a dietitian, a trainer, nutritionist, and have them proceed forward with that. If it's somebody who has multiple comorbidities, medication, as well as, let's say they have 75 or 100 pounds to lose, I'll offer our physician prescribed weight loss program. It's something that I prescribe for them, tell them exactly what to eat, how much to eat. It's for about a 6-week period of time. they're going to go through withdrawal symptoms from sugar. Similar to that, they're going to feel like they have the flu and things like this. This is very severe when it comes to people coming off sugar, and you have to recognize that. Walk them through the whole process, and usually by the end of that program, they feel detoxed and feel good and energized, and they're starting to exercise, and then we connect them with a personal trainer to continue down that path. So that's the typical 90% of the people that I work with. Other, like I said earlier, was the emotional and mental support side of it, which we're actually seeing more of that. We refer them out to a counselor. All of this information, all of their health information is kept in a separate HIPAA compliant program than our claims adjusters work out of, because we want employees to know we're doing this for the right reasons, and we are. We can also do this program under the group health plan, and we are 100% up, have proceeded forward with being able to move forward with this under this. It's just the difference is that it has to be part of the plan documents, which is a whole nother conversation, but the services can be covered under workers' compensation or the group health plan.
That emotional and mental support, there's a lot of times with workers' comp injuries, there's an element of emotional feelings and some mental health that usually goes along with the claim. So we have used more counseling services in conjunction with the enhanced case management. Usually these are more severe claims that we're administering services to, and usually there ties an emotional piece of it.
Okay, Katie. Okay, so we've designed specific programs for clients who have specific needs. One specific program that we have developed is called the Badge of Health. This is a trademark program specifically for law enforcement officers and firefighters. Basically, we work with the department. It's considered our pre-incident program. So the way that this program started was I was working with different law enforcement officers and firefighters, and they would have comorbidities, and then next thing you know, they come in and 12 weeks later, they're 50 pounds lighter and they're feeling good, and the chief and the sheriff come, say, what the heck did you do? And they said, well, we worked with IPMG on their enhanced case management services. And then other employees would say, well, how do I do that? And, of course, my answer was, well, you have to file a workers' compensation claim. No, I never said that. I'm just kidding. Never would I say that. But so we had to design a program that was before injury that is basically funded by the department. And this program is highly engaging. We do a biometric screening, and on-site, or they can go to a LabCorp. We order the labs on the patient. I review, and our nurses review all of the labs. And every employee who engages in this program gets a one-on-one consultation with me. I review their labs, and our nurses will reach out to them as well. But it's basically goal setting. What do you want to achieve? What is your blood glucose levels, your cholesterol, all this kind of stuff. Offer them things that they can do naturally and conservatively to change their numbers. I cannot begin to tell you, I just finished with a group out of Kansas City, and out of 10 people who actually engaged in our physician prescribed weight loss program, the greatest amount of weight that was lost was 47 pounds. But amongst the group, they lost over 300 pounds. It's pretty exciting when you can see those results. The chief is very, very happy. And when you look at what's going on in law enforcement right now, these guys need a break. They're up against a lot of scrutiny, a lot of stress. So when you take a law enforcement officer who is under an increased amount of stress, COVID-19, inability to know what to do with their health, they had downhill very, very fast. So we offer them the solutions they need in order to get them physically healthy, emotionally and mentally healthy, as well as their labs healthy, and then offer quarterly educational programs thereafter for the remainder of the year. So I'm still working with this group up until the end of the year. So
some of the things that we look for in the response space for work comp, the comorbidities that we try to go after to apply these services, are the same things that we're looking for in the pre-incident space. We know the success that they have in getting the person healthier and thereby uncomplicating the injury recovery and some of the things that go along with that. If we're able to do that in the front and before an injury or incident happens, we're way more successful if an injury incident does happen. So this is really a genesis of the client's interest in our success from enhance our response efforts to get into the pre-incident space. So this system is doable in any industry. We would just have to really understand and appreciate the data and where really the benefits are being driven from. And we can design similar systems that really are focused on that particular industry and administer those services to get to the same success that we've had, kind of targeting like law enforcement, public safety, fire, corrections, because of our interest in how much experience we have in public entity management.
okay, go ahead, Katie.
I have a question really quick. This is a huge in the public sector. Have you ever worked with CVMIC, Cities and Villages Mutual Insurance of Wisconsin?
I have not.
So we're operating and working with pools in several states in the Midwest. We are not working with that pool right now or that mutual. We do work with individual cities and large self-insured clients. That's kind of our specialty. So we're very familiar in working with those folks. So if you want to send in the information, we'd be happy to contact you and explain or get into some of the mechanics of it.
Okay, I see we're getting close on time here. I'm gonna just kind of go through a handful of testimonials here. Candy, let me see, this was a while ago. She started at, she lost 20, oh, hold on a minute. Oh. She weighed 228 pounds starting working with me. At the end of working with me, she weighed 174 pounds. She lost 54 pounds. She felt absolutely fantastic. She was more than happy to send in the testimonial. And from my perspective, I couldn't care less about insurance one way or another. I like to work with patients. And one of our vice presidents, Todd Greer, he always laughs at me because he says, he oversees our underwriting division. He's like, Kim, just keep loving your patients. It's great on our end. So financially. So when we look at this claim, the total payments on her claim from her injury, she had a knee injury, was $34,000. But you can see that, and we figured these out by reserve takedown. Our savings were roughly $58,000. So this lady did astronomical, and this is normal. This is like I bet you we get results like this every 2 weeks now. This was when we initially started the program. So next one. So this is still my favorite. He was a 13-year police officer. He injured his knee, and after failed knee surgery, he had to have another knee surgery. His doctor told him that he could not do the surgery until he lost 100 pounds. He was a law enforcement officer. He struggled for, I think, the details are in here, but it's somewhere like 6 months or so where he could not lose any weight at all. I reached out to him. I offered him the program. He was all in. And this was in 2017. He sent me a text message 2 weeks ago of a picture of him today, and he looks better than the picture below. When he went back to his doctor, we had helped him lose 100 pounds. Did absolutely fantastic. When he went back to his doctor, I told him, hey, you should probably get in there to schedule your knee surgery now. You're down all this weight. His doctor evaluated his knee and said that he doesn't need the surgery anymore. I was the first person he called. He came out of the doctor's office. Mind you, this is a workers' compensation claimant who's been off of work, police officer, and I'm the first person he called. He said, Dr. Kim, you changed my life. I did not need the surgery and I can go back to work with no restrictions. He sends me pictures of his wife, his kids. They're in the gym every week. This is a classic, true example of someone who we changed their life. And you know, if this is what it's about, what a great job, huh? It's a fun job for me. Okay, go to the next one. Here's another one. This is she's going to send out the this is just a very heartfelt, nice letter from him. He's a first responder, and he just said that I was his first responder. He got really good results with his weight and felt better, and we saved a bunch of money on the claim for the client, and just you can see the before and after pictures there. I'm trying to save time here. So one of the things that people ask me, what are my favorite resources? This is something for you all to take home with you. I have a really good friend who was down here visiting me at my home this past week, and he and his wife were here and identified, not that I'm the friend that hangs out and looks at your health problems, but he asked me to. And these are some of the resources that I sent him to. So Weight Watchers 0 points list. What I tell people on this program is just Google the Weight Watchers 0 points food list. Eat as much as you want off that list, and 2 meals a week, eat anything you want. That's a great resource, and it includes, you know, chicken and oranges and fruits and vegetables and all that kind of stuff. Of course, our physician prescribed weight loss program, that has to be prescribed by a physician. They do not work with just the regular public. And then MyFitnessPal is a great way to track your calories. So I have some people that don't want to be that strict, but we have to meet people where they're at in order to create change. Obviously, the employee assistance programs, counseling, and working with trainers and you know, remote training. Next. So this is kind of driving it home here, the conclusion. This is the same slide that Greg kind of touched on at the end of when he was done. 20% of your population is driving 70 to 80% of the cost. So if we can even get a handful of people engaged in these programs, you're going to see astronomical improvement in the culture of your organization, in the health of your employees, the employees wanting to come to work. People want to share success, as well as during this critical novel coronavirus time, we have to provide this type of service to the employees. We have to get engagement at all levels, from employer, employee, family. We have to change who people are versus what they do. So I'm going to wrap it up there. Does anybody have any questions? Katie, you're the one who can see that.
I am not seeing any more, but if anyone wants to email them into us, please feel free.
Okay, well then I'm going to take 1 minute to explain something then. When you guys are out and about, this coronavirus can be transmitted via air droplets. Somebody coughs, you go walking through it, you can contract the illness. I explained the R0 value on how infective it is. It can be spread via the fecal oral route. So if someone uses the bathroom, they don't wash their hands, that can be spread that way. And it can also live on surfaces, and you touch your mucous membranes, such as your eyes, your nose, your mouth. All you need is 1 single droplet. So just whatever you do, wash your hands. You guys see this? I'm not telling you something you don't know, but wash your hands, wear your mask, be protective and considerate of other people as well. It can live in your body 4 to 14 days before you even have symptoms. So it is so important for us, so that at least our healthcare providers, I mean, obviously we don't want it to spread to people with significant comorbidities, but our healthcare providers can't keep up. We have to do our part. So everybody stay safe and healthy. Thank you for attending.
Thanks, everybody.
Thank you, Kim and Brian. Hope to see everybody after the holiday. Have a safe and happy holiday, and thank you for your time and attendance today. Take care, and we'll talk to you very soon. Bye-bye.